So we want to talk more about this as a lot of people are interested in this developing story. As each layer unfolds, there are questions and concerns as well. So we want to bring in Dr. Felipe Lobelo with Kaiser Permanente to answer some of those questions. Thank you for the time. Appreciate it.
Yes, it's a pleasure. Thanks for having me.
So a lot of people may be hearing about hantavirus in depth for the first time, and there were some questions as this was first coming out publicly about what was happening on the cruise ship, because most commonly, right, hantavirus is based linked to rodents and droppings and urine. But then there were some conversations about could this be person-to-person contact. So can you just tell us what do we need to know about hantavirus and how it is transmitted related to this case?
Yes, Sharon. So what makes this case unusual and interesting from a scientific and epidemiologic perspective is the fact that it's the first time that we see an outbreak of hantavirus in a cruise ship. Typically, these outbreaks happen in rural areas, whether it's in North America, in the desert region, in Four Corner areas, or in South America, in areas in Chile and Argentina. So clearly, what's happening here is that virus, the Andes strain of hantavirus, got infected. One person got infected from it probably bird watching and this trip in Argentina. Then that person got into the cruise ship, and because of the close contact in the cruise ship, we have reports from previous outbreaks that this variant of the hantavirus can transmit, not easily, but can transmit person to person, especially when there's a lot of close contact, like it would happen between couples or living in close quarters in a cruise ship. So essentially, that's what we're dealing with right now. The risk for this to become a pandemic or to spread to a large number of people is very, very, very low. And obviously, these two patients being treated at Emory, the special pathogens isolation unit, is the best that we can have right now.
I'm so glad you said that, Dr. Lobelo. I think that is the number one question that we're hearing. And the number one concern, too, is where does this go from here? Is there a potential further spread that happens? And then I think as people watch the images today at the airport, as these two people finally get back to Georgia on home soil in that regard, but they're coming off the plane in full hazmat suit. That's a necessary precaution, right? As they're transported from the airport to Emory, and Emory being a place that has a long history of dealing with communicable diseases.
Absolutely. There's top nationally funded places where in the US where we have the ability to do this isolation and treatment for special pathogens, virus like Ebola, in this case hantavirus. One is in Nebraska, one is in Maryland at the NIH, and one is at Emory. And they have a lot of experience with previous outbreaks of Ebola and other special pathogens. Clearly, there are precautions that need to be taken for these patients that are symptomatic, that are have had close contact with other cases, and that's why the special PPE, the personal protection equipment that you're seeing as these patients are transported from the ship to the planes to now the hospital. But clearly, this is an abundance of caution to make sure that the virus is contained. There is no other close contacts or potential for infecting other individuals, and to take care of these patients, because we know that once you have symptoms from hantavirus, some of these patients can progress rapidly to respiratory insufficiency. They may need additional support, and obviously being in the hospital is the best that we can have for the health of those patients.
I think we have some video of the moment the plane arrived in Atlanta, as I want to get your medical perspective on this. We think it's really important to communicate with the public that as they saw the images of this is not a case where these two people were taken into kind of the general public areas of the airport. Obviously, they were taken to other transportation right off the tarmac to limit any exposure. I think it's really important because we kind of anecdotally were talking to some people at the airport wondering like, am I at risk because I'm at the airport on the same day? And you would reiterate, no, that's not the case for the general public, correct?
Correct. all the precautions are being taken from the Spanish authorities that helped those patients first disembark the cruise ship to the transportation via air. And now, as patients are arriving, not only in Atlanta, but also in Nebraska and in other parts of the world, to make sure that they are shuffled and isolated from the general public using specialized protection equipment and taken directly to the isolation units, so where they're going to be isolated for 42 days. Those are the guidelines that the WHO now is suggesting. And in case they have symptoms, obviously being managed medically by these very well-trained infectious disease physicians, in this case at Emory.
We know the two individuals who are from Georgia and are now back here in Atlanta. We understand it is a couple who had been on that cruise ship together, and one of them reporting some symptoms. Can you walk us through what those symptoms look like in a case of potential hantavirus?
Yes, the initial symptoms are similar to those of the flu. So you have fever, potential cough, shortness of breath. And what's important here is that, as I mentioned, in some cases, those symptoms can rapidly progress to a deeper infection in the lungs that can essentially make you difficult to breathe. The lungs get filled with fluid, and some of the time these patients require mechanical ventilation or support systems so that they can sustain that high risk period of the infection. Unfortunately, the fatality rate for these viruses is very high, between 30 and 40%, and we don't have a specialized treatment or vaccines. All we can do is support them medically, and that's obviously the reason why they're going to be this very well equipped special pathogens unit at Emory.
To your point, the fatality rate being high, which is why there was such urgency around this, became an international response. As this is the video viewers are watching now of one of the patients here returning to Georgia in that full hazmat suit, in that white protective gear. We understand they'll be monitored for over 40 days at Emory. Dr. Lobelo, that's because it takes a while for symptoms to appear in many cases, right? So you've got to have a prolonged period of watching them medically. Is that true?
Correct, and that's one of the reasons why this virus sometimes is tricky, because the incubation period, meaning the period where you can potentially exhibit symptoms after being infected, is long. It can range from 1 to 8 weeks. So the 42 days is what the infectious disease specialists at the World Health Organization have suggested should be the quarantine period, to make sure that daily monitoring these patients are not exhibiting symptoms. Obviously, there's also routine testing to make sure that they are not becoming positive, and making sure that, again, they're close to highly specialized medical equipment and personnel in case they should need that.
I want to talk a little bit about the response and the timeline. We were seeing videos from people on the ship, pleading to get off the ship. April 11th was the day that the first person confirmed to have died from the hantavirus. And then it was about a month before the evacuations took place. But from your medical perspective, is some of the timeline, because they have to get it right. You have more than a dozen countries represented, and once people get off the ships, they then scatter. So the logistics are very important to make sure that they can contain this situation. Is that medically maybe why we have seen it take some time to make sure that what happened on that ship does not go out into other communities?
Absolutely. The logistics here, as you mentioned, are complex. It's a complex choreography of, coordination with local health officials, in this case in Spain, that had the ability to be able to retrieve these patients from the cruise and be able to organize the logistics for planes from different countries to receive those patients, take them to specialized isolation units in each of those countries. We're talking about patients in Canada, in the U.S., in several European countries. So it took some time to organize that effort, and obviously the World Health Organization and local health authorities need to be in constant communication and planning these details and logistics to ensure that there is no risk of contaminating other people or the virus or the outbreak becoming larger. That's essentially what they're trying to do. Unfortunately, some patients got off the cruise ship before we knew about this outbreak and before we had confirmation of the virus. So there's also a process of making sure that those patients are also being monitored to make sure that they don't have symptoms. But a lot of those patients are back home and are being routinely monitored by public health authorities, not only in the US, but in other countries.
Takes us back to the days of contact tracing during COVID, making sure that everyone is accounted for and we know the contacts they've had. I'd love for you to take a moment to address any misconceptions or falsehoods maybe you've heard about this. Important to make sure that we're highlighting fact over fear as it relates to hantavirus.
Yes, right now we are unfortunately starting to see in social media misinformation, and it's understandable that we've coming from the COVID pandemic, where a lot of feelings are still remaining on the risks of these outbreaks and these epidemics. But hantavirus is not COVID. This doesn't have the potential to become a pandemic or large scale outbreak because of the nature of the virus, because it requires really close contact, because it's not as easily transmissible as COVID. But it is a wake-up call that we need to have these public health systems in place. The funding of the public health authorities, unfortunately, has been slashed over the last couple of years. The ability of the CDC to even be in touch with the WHO and help coordinate has been diminished because we're not a part of the WHO anymore. So this is making more difficult the job of public health and authorities to control not only this outbreak, but potentially future outbreaks, because we know those are going to happen. These zoonotic infections where viruses jump from animals to humans are going to keep occurring. And we need to be better prepared in the future. And part of it is funding and it is support for public health systems.
Dr. Felipe Lobelo with Kaiser Permanente, we really appreciate the information and your time. Thank you so much.
It's a pleasure. Thank you.